what is the definition of lymphadenopathy? What do we mean when we say lymphadenopathy?
lymph node enlargement.
معلش أنا ميوت عندي فما سمعت. تفضل محمد.
أقول دكتور lymphadenopathy lymph node enlargement due to cancer, due to infection.
طيب very good. هذا بالعادة أهم سبب فيها. Once we say lymphadenopathy معناته إن size is different. But can it be something else other than size?
الشيب لو سوينا الترا ساوند او الملمس ممكن يكون فريم.
ايوه very good. consistency والسايز والنمبر، هاي الثلاث اشياء اذا تغيرت نقدر نقول عليها lymphadenopathy. excellent. طيب let's suppose that you have a patient within an enlarged lymph node. What are the things in history that are important that you need to ask? Okay, history taking. Okay, pain. Is there any pain or not? Excellent. What else? History of infection. Very good. Fever. Yes. ما كنت أتوقع إنك تقول fatigue. History of cancers. Weight loss. Muhammad. Excellent. Malaise or fatigue. Yep. What else? Night sweating. Excellent one. Muhammad. Vaccination. محمد. Yes. طيب خلينا نخلي الاشياء الاكزامينيشن داتا يا احمد. What else by history? طيب you could ask them about location but it's نحن قلنا كل constitutional symptoms قلناها اللي هي sweating, weight loss, malaise, night sweats. What else? إن في fever ولا لا? About the lymph node itself, what can you ask? Okay, excellent, Muhammad. History of travel, lump history, progression, yeah. So when was it first noticed? And how? What else? Family history. Is there any family history of similar swellings or family history of cancer in general? Any other lump? Yeah, it's very important. If he noticed this one and he's concerned about this lump, did the parents, يعني طبعا على حسب الage of the child, did the parents notice any other lump? History of any radiation? Ask if it is moving or not. You could ask this as well, yes. طيب along الانفكشن قلنا travel. What else we should ask about? في الهيستوري of infection. واحدة منها اللي هو travel. What else? كexposure يعني. مش قصدك فاهم؟ Any sick contacts? Has he been in contact with anybody who's sick? هذا important in certain diseases مثلا TB. What else? Other contact history. Injuries, excellent, yeah. If there's any cut, wound that could predispose to skin infection. The animals contact, we should ask about, has he been in contact with any animals? خاصة cats, cat scratch, في شيء نسميه cat scratch disease. هذا ممكن يسبب لك lymphadenopathy. Ingestion, raw milk ingestion, you could يسبب لك brucellosis. Brucellosis could predispose to lymphadenopathy. But those are important to ask in history as well, history of exposure. What else?
دكتور ما أدري بس إذا ممكن نسأل الأهل هل يبوس الطفل لأن infectious mononucleosis ما asymptomatic عند الأدلت فما يعرف هو infectious ولا لا يعدي الطفل.
Yep, this is a good one. Yes, what's most likely will be children will get it through kisses, as you said. A possible one. It will present as lymphadenopathy or hepatosplenomegaly in children. في adolescents usually with malaise along with the hepatosplenomegaly and lymphadenopathy. It's a good one. Yep. طيب هذا بالhistory. بالphysical examination, what are the important things that you need to examine? General appearance, excellent. I'm glad you started with it. The general appearance is very important. Movement of the lymph node. طيب Mekki, will you be concerned if the lymph node is movable or not movable?
دكتور
What is more concerning?
if it's not movable.
If it's not movable, okay. طيب tenderness or non-tenderness, what is more concerning?
Tenderness.
If it's tender, it is more concerning. Are you sure?
No, not tender. Sorry.
صح, if it is non-tender, it's more concerning. Right, very good. What else you need to examine? طبعا بنغطي هذه الاشياء بعد شوي بس مو لازم انت مكي. السايز very important. صح يا حسن. shape وش قصدك بالشيب يعني it's not very important shape. هل هو regular ولا irregular ولا وش قصدك ولا fused not fused؟ طيب very good محمد حسين. That you would like to examine all the lymph node areas, so cervical, supraclavicular, abdominal, inguinal. زي ما قلت أحمد, is it multi or uni? Consistency, very important. Very good, very good. طيب, excellent. I think you get them all. نحب نغطي الأشياء المهمة بالphysical examination. How you would approach if you get someone with the lymphadenopathy. It's excellent. You have the good general. طيب. So as we said, the term lymphadenopathy refers to lymph nodes that are abnormal in size or number or consistency. Anything that's pathological, that's abnormal with the lymph node will be considered as a lymphadenopathy. Right. Formulating a differential diagnosis require consideration of several important clinical features. وهذه الأشياء اللي بنغطيها اليوم, and how each one of them would help us to make our differential diagnosis. واحد منها اللي هو age of the patient, size of the node, when we would consider this is abnormal size, the location and how it is important, the quality of the nodes, and whether lymphadenopathy is localized or generalized, with time course and other associated symptoms. فلما نبدأ بالpatient age, the normal size of various lymph nodes change with age. بس كgeneral idea, lymph nodes are not palpable in the newborn. Generally, all the lymph nodes are not palpable in the newborn لأن ما في exposure yet للantigens. The lymph nodes are small and they shouldn't be palpable for newborn. So any palpable lymph node in the newborn would be considered as abnormal. But it's not common though. Over time and with antigenic exposure, the volume of the lymph node increases لين يصير normal size. فالpalpable lymph nodes بالcervical, axillary والinguinal regions are normal throughout the early childhood. ففي early childhood, if you find cervical, axillary والinguinal lymph nodes that are palpable, it's okay up to a certain size, which we will be discussing later. The differential diagnosis of lymphadenopathy changes substantially with age. For example, Hodgkin lymphoma is an important cause of lymphadenopathy in adolescent with adult patient, but it's rare before 10 years of age. إذا جاك واحد عنده lymphadenopathy below 10 years of age, المفروض إنك ما تحط Hodgkin lymphoma as one of your differential because it is rare at that age. Keep in mind, there are some congenital lesions that may be confused with lymphadenopathy and should be considered in the differential diagnosis of a neck mass. مو شرط إنها تشوف neck mass, it's always a cervical lymphadenopathy. For younger children, think about these congenital lesions زي cystic hygroma, branchial cleft cyst, thyroglossal duct cyst, ولا cervical rib يصير عالي شوي. طيب السايز, هذه القاعدة عشان تعرف what is the normal size and when you would consider this as an abnormally enlarged lymph node. الابيتراكلير اللي هي ورا المرفق, okay, في التراكلير. This is up to 0.5 centimeter in size. So anything above 0.5 would be considered as abnormal. The axillary with cervical up to 1 centimeter in size, it is normal. The inguinal up to 1.5 centimeter in size. I think it's easy. أهم شيء تركز عليه اللي هو الأكسيلري والcervical 1 centimeter والinguinal 1.5. The risk of underlying malignancy increases with increasing size of the lymph node. يعني كل ما زاد size كل ما الريسك of malignancy would increase. استخدم 2 centimeter as an important threshold for the cervical nodes في الchildren. احنا نتكلم عن الchildren. في الادolescents ممكن تستخدم 1.5. بس في الchildren إذا جاك واحد عنده cervical lymph nodes more than 2 centimeters, this is highly suggestive of malignancy. Location, is it important ولا لا? The location of the abnormal lymph nodes can direct the clinician in a thorough search for potential source of infection. Keep in mind إنه كل lymph node, كل group of lymph nodes drain lymphatic tissue of a certain area. فمهم إنك تعرف كل group من lymph nodes what area it covers. Examples, in large axillary lymph node can be caused by what we call the cat scratch disease. إذا the cat scratches somebody on his arm, the arm is covered or is drained into the axillary lymph node. فأي infection the skin of the arm may cause enlarged axillary lymph nodes. The anterior cervical lymphadenopathy is commonly enlarged in the cases of pharyngitis. واحد جاء عنده التهاب في الحلق واللي عنده tonsillitis التهاب في اللوز. في الغالب cervical lymphadenopathy will increase in size with it. A palpable lymph node in the supraclavicular fossa is worrisome. Supraclavicular fossa المفروض ما تكون فيها any palpable lymph nodes. Malignancy is high in differentiated diagnosis if you find a supraclavicular fossa lymph node. Inguinal and axillary lymph nodes generally are associated with a lower likelihood of a disease. هذه بس باختصار المناطق اللي تغطيها كل group of lymph nodes. مو مطلوب منكم تحفظونها بس for your information if you want to go back to it. Okay. زي ما تشوفون هنا الأوكسيبيتال it covers the posterior scalp. البوست auricular اللي هو خلف الأذن مباشرة it will cover أو الtemporal والparietal scalp. فإذا جاك infection في المنطقة هذه الليمف نود اللي بيزيد حجمها. نفس الشيء مثلا إذا شفت السبمنتال اللي تحت الدقن lymph nodes it covers the lower lip with floor of the mouth. So you should examine if you have somebody with submental lymphadenopathy, you should examine the lower limb for any signs of infection and the floor of the mouth. You should ask him to open his mouth and explore the floor of mouth for any abscess or ulcers. زي ما تشوفون هنا مثلا الاكسيلاري, الارم, البريست, الثوركس والنك. So if you have somebody with axillary lymphadenopathy only, we should examine all these areas for a possible infection or malignancy. الارم, breast, thorax, and neck, and so on. Okay. So quality of lymph nodes, زي ما قلنا, tender lymphadenopathy إذا لمستها وتعور most frequently is caused by infection, especially if there is associated erythema, warmth, induration, or fluctuance. كل هذه علامات إنها نفس الليمف نود ملتهبة. مهم وقت ما نفحص المنطقة نفحص skin over the lymph node. هل skin over the lymph node في signs of inflammation؟ هل في erythema؟ هل في warmth؟ هل في induration or fluctuance إذا صار فيها pus or abscess. Occasionally, بس هذا ما هي الرول حق التندرنس ما هي دائما 100% صحيحة. Malignancy can cause no tenderness because of hemorrhage into the node and subsequent stretching of the lymph node capsule. يعني الغشاء اللي مغطي محوط بالليمف نود ممكن ينشد إذا صار في bleeding وسط الليمف نود. فهذه الحالة ممكن تصير في malignancy and it would cause a tenderness. Nodes that are soft, easily compressible, and freely mobile frequently are benign. Okay? The hard nodes are found in the cancers that include fibrosis and when previous inflammation had resulted in fibrosis. فالهارد نودز ممكن تكون بسبب كانسر لأنه هو يسبب fibrosis أو because of the previous inflammation and result in fibrosis. وممكن تكون بسبب كانسر أو بسبب inflammation. Lymphatic nodes frequently are firm and rubbery. اللي كان بس فيها lymph node ما فيها metastasis ممكن تكون firm و rubbery. Nodes that become fixed or matted to each other. matted يعني تبدأ تلتصق مع بعض ما تصير مفصلة ما تقدر تحس إن كل واحدة لحالها. are usually result from invasive cancers or from inflammation in the tissue surrounding the nodes. من أشهر الأشياء اللي تسوي هذا الشيء tuberculosis. tuberculosis يسبب inflammation بالskin around the lymph nodes فتتشبك مع بعض أو sarcoidosis. هذول بيسوون لك fixed or matted. شوف مجموعة الليمف نود تتشبك مع بعض تصير متلاصقة مع بعضها البعض. Okay, so this could be due to cancer or inflammation in the tissue surrounding the nodes because of tuberculosis or sarcoidosis. كل واحدة على حسب وصفها تعطيك possible differential diagnosis. Again, is this a localized or generalized lymphadenopathy? طبعا وقت ما نقول localized معناته single area. يعني ما هو single lymph node لا single area مثل axillary كلها. واضح؟ Generalized when there is two or more groups or sites are involved. فkeep in mind generalized مو معناته كل الجسم. مو معناته كل lymph nodes enlarged. معناته two or more. This will be considered as generalized. Localized adenopathy can occur from infection of the node itself نسميه lymphadenitis. طبعا لما تصير نفس الليمف نود infected ما هو enlarged because of a certain area that is draining into this lymph node. إذا كانت هي نفسها infected نسميها lymphadenitis. يعني نفس الليمف node is getting an inflammation. localized هذا possible differential بالغالب يا من نفس الليمف node is infected أو it's an infection in its drainage area. واضح؟ generalized adenopathy ممكن تكون بسبب systemic disease خاصة إذا لقينا معها hepatosplenomegaly ولا rash anything that's systemic involvement along with the lymphadenopathy. Think about systemic diseases أو malignancy طبعا. Time course with other associated factors or other associated symptoms are important as well. General rule, many advocate biopsy of concerning nodes that have not decreased in size after 4 to 6 weeks or have not normalized completely in 2 or 3 months, 8 to 12 weeks. في نفس الليمف نودز ما صغر حجمها خلال 4 أسابيع المفروض نسوي لها بيوبسي أو إذا بدأ يصغر حجمها بس ما وصلت الحجم الطبيعي على 2 إلى 3 أشهر المفروض نسوي لها بيوبسي. On the other hand, lymph nodes that have been present for a very long duration are not likely to be malignant. أنت جاك واحد وعنده lymph node ممكن يصير هو عارف عنها تسأله تقول هذه كم لها عندك؟ يقول والله من 2 سنين. معناته ما هي مقلقة. لأن بعض الناس يصير عندهم واحدة بس one lymph node is large and doesn't decrease in size over a long period of time. خاصة بالسيرفيكال. السيرفيكال في بعض الأشخاص اللي عندهم large nodes that's been there for a long time. Keep in mind one exception is Hodgkin disease. Hodgkin sometimes it becomes very slow in progression. فبعض الناس ممكن يصير عندهم lymphadenopathy for 6 or even to 12 months before diagnosis. فkeep that in mind. ما هو معناته انها موجودة لمدة 12 شهر انها completely normal. اسأل عن الأعراض الثانية. زي ما قلنا ال history should also focus on exposure to animals, uncooked meats, unpasteurized milk, medications, some of them can cause lymphadenopathy, will associated constitutional symptoms اللي suggestive of malignancies زي fever, night sweats, weight loss, pruritus, arthralgia, or fatigue. طبعا this is the differential diagnosis. زي ما تشوف infection is a big part of it, and it could be anything. So it could be bacterial, and it will be differentiated whether it's localized or generalized. زي ما قلنا localized يا اما skin infection Staphylococcus aureus او group A strep في الفرنجايتس. الانيروبس if it is an oral disease. الcat scratch disease زي ما قلنا. الثانية مو مهمات. الجنرالايزد زي ما تعرفون البريسلوسز، عشان كذا مهم نسأل عن إذا كان تعرض الانيمالز ولا أكل uncooked meat or unpasteurized milk. والتايفويد فيفر. الفيرال don't forget about them including ال HIV والهيباتيتس والEBV زي ما قلنا. المايكوبكتيريا whether it's tuberculosis TB or atypical, as well as الفنجل, syphilis, protozoa, malignancy كلكم تعرفونها. immunologic diseases من أهمها اللي هو SLE, rheumatoid arthritis, sometimes زي ما قلنا due to drugs as well. Endocrine, hypothyroidism or Addison disease could cause lymphadenopathy. Other diseases زي الكواساكي ولا sarcoidosis. There are certain specific causes of lymphadenopathy زي ما تكلمنا عنها قبل شوي اللي نسميه reactive lymph node. Reactive lymph node, it's a reaction to an infection in the drainage area, which is the most common cause of localized enlarged lymph nodes in children. زي ما قلنا واحد يصير عنده pharyngitis ولا otitis media ولا conjunctivitis. Lymph node اللي drains this area would react to this inflammation, then it fight the infection. فالوايت blood cells والlymph sites بتتجمع في الليمف نودز فبيزيد حجمها. Okay, those will cause cervical lymphadenopathy. Lymphadenitis defined as inflamed, enlarged, tender lymph node. Most common organism Staphylococcus aureus group A Streptococcus. Typically the onset is acute with development of tender erythematous warm lymph nodes. بتبين علامات الانفلاميشن على الليمف نود itself. يعني بتشوف السكن اللي على مغطي الليمف نود لونه احمر واذا لمسته حار. نجي الان للdiagnostic evaluation. So whenever there is worrisome features suggest a serious underlying disease, whether there is a laboratory tests or imaging, and biopsy may be indicated. فإذا كان عندك أي شيء suggestive of abnormality, you should investigate this lymphadenopathy. سواء عن طريق اللاب، سواء عن طريق الإيمجز أو البيوبسي. Keep in mind, the corticosteroids should never be administered without a definitive diagnosis. ليش? Because they can mask the diagnosis of leukemia or lymphoma and adversely affect the prognosis. إذا أعطيت corticosteroids بسوي suppression أوكي للليمفوسايتس بسبب change في الكلينيكال picture. وقت ما تسوي البيوبسي يمكن الهيستوباثولوجي wouldn't be able to identify the malignant cells. But this will cause a delay in diagnosis. If you're in doubt, get a biopsy before you do or before you give corticosteroids. This is an important rule. So in the case of a localized cervical lymphadenopathy which is the most common. في البراكتس بيجيك طفل عنده localized cervical lymphadenopathy. An observation of 4 weeks is reasonable if no features in the history or physical examination suggest malignancy. إذا أمور كلها كويسة بس عنده cervical lymphadenopathy قل لي يرجع بعد 3 إلى 4 أسابيع for a follow-up with observation only. If you think it's bacterial lymphadenitis إذا نفس الليمف نود سكن اللي حواليها أحمر أو warm أو في fluctuations، إذا لمست الليمف نود تحسن جواتها في pus. That's suspect bacterial lymphadenitis. If it's this suspected, start antibiotics. The first or second generation cephalosporin should be enough. And oral is fine. If there is no response to oral antibiotics, tuberculin skin test should be placed as part of the evaluation for atypical mycobacteria. Not for TB, لكن for other mycobacteria اللي هو نسميها atypical mycobacteria. Atypical mycobacteria commonly cause lymphadenitis. فإذا أعطيتهم antibiotics وما تحسنوا عليه still في signs of inflammation lymph node, think about the atypical mycobacteria. Do tuberculin test. Referral for biopsy is appropriate if there is continued progression or lack of any regression within 4 weeks. وخلي هذه ال 4 weeks هي الجايد لاين حقك. إذا ما شفت أي تحسن أو شفت إنه قاعد الموضوع يسوء حتى قبل ما تنتهي ال4 أسابيع سوي البيوبسي. Immediate biopsy should be considered in the case of enlarged supraclavicular lymph node لأن قلت زي ما قلنا supraclavicular this is abnormal. If you find supraclavicular lymph node, you should do immediate biopsy. Or if there's findings suggesting malignancy, such as hard, fixed, or non-tender nodes. هنا ما تنتظر 4 أسابيع because those are worsen and you should do immediate biopsy. If in the absence of related symptoms suggesting infection, جاك طفل بس ما عنده أي history of infection وما عنده الآن infection, فليش lymph node is enlarged? And then you should do immediate biopsy. If there's fever lasting longer than 1 week, do biopsy. If there's constitutional symptoms, خاصة night sweats ولا weight loss greater than 10%, this is worsen for malignancy. Do biopsy, immediate biopsy. If you do مثلا CBC or chest radiograph or inflammatory markers and you find them abnormal, مثلا عندك low white, عندك pancytopenia ولا عندك leukocytosis, high leukocytosis ولا chest radiographs فيها lymphadenopathy, or you have elevated ESR, consider doing an immediate biopsy. Which lymph node we should biopsy? As a general rule, the largest and the most abnormal node should be biopsied. In general, the inguinal and axillary lymph node are less likely to be diagnostic. So we should avoid them and get يا إما cervical ولا other hypertocular ولا supraclavicular. The highest yield is obtained with the supraclavicular or lower cervical chain node. Okay. هل الآن واضح بالنسبة لكم if you get somebody with lymphadenopathy what to do with them? When to be concerned and when not? ولا تحسون الآن ما في clear guidelines? شباب؟ طبعا هذا مختصر لكن أتوقع for your level this is what you need to know. تفاصيل زيادة تلخبطكم زيادة. But this is what you need to know at your level. When to get consent and how you do your general assessment.